Have you noticed your bladder is now in charge of your day and your night? You plan car trips around toilets. You wake up 2, 3, even 4 times to pee. You stand at the bathroom, waiting, with a slow, weak stream. And a small thought crosses your mind. Is this just age, or is my prostate getting worse? If you are a man over 60, you are not alone. An enlarged prostate is extremely common at your age, but common does not mean you have to suffer in silence. I'm Dr. Rosalia Viterbo, and I help men protect their health with simple, science-based habits. Today, I want to speak directly to you, to the man who is tired of broken sleep, tired of feeling older than his years, and worried, quietly, about his prostate and his masculinity. Here's the good news. There are daily habits that can support a healthier, calmer prostate. Habits that can reduce pressure on your bladder, improve your urine flow, and help you feel more in control of your body again. In this video, I'll walk you through 3 habits you can start today. They are natural, they are doctor-backed, and they are realistic for real men with real lives. They will not replace your medications or your urologist, but they can work alongside your treatment to help your prostate, your sleep, and even your confidence. Let's talk about what you can do, starting now. Let's be honest. Needing the bathroom all the time is more than just a small annoyance. It affects your sleep, it affects your mood, and over time, it affects how you feel about yourself as a man. You lie in bed at night. You finally get comfortable. Then that familiar urge appears again. You get up, walk to the bathroom, and maybe only a small amount comes out. You come back to bed. Your partner is sleeping peacefully. You, on the other hand, are wide awake. By morning, you feel tired, irritable, less patient with family, less focused at work or in your daily tasks. And during the day, it doesn't stop. You scan every place you go. Where is the nearest toilet? Meetings, car rides, even simple errands become a little stressful. Many men also feel embarrassed. They don't like to talk about the prostate. They think, this is just what happens when you get older. But here's the important thing. Just because something is common does not mean you should ignore it. An enlarged prostate, called BPH, is usually not cancer, but it can seriously affect your quality of life. And if you keep ignoring your symptoms, things can gradually worsen. You might start to avoid drinking water just so you don't have to pee. You might avoid social events or long trips. Some men even feel it affects their desire and confidence in intimacy. Ask yourself for a moment, how much has this already changed your daily life? How long have you been telling yourself, I'll deal with it later? Your body is sending you signals not to scare you, but to get your attention. The good news is you are not powerless. There are simple things you can do each day to support a calmer prostate. And small changes, done consistently, can make a real difference over time. Let's go through them one by one. 3 daily habits to support a calmer prostate. Now let's talk about what you can actually do. 3 realistic habits, everyday tools you can start using today. These won't cure an enlarged prostate, but they can reduce pressure, calm symptoms, and support what your urologist is already doing. First habit, control when and what you drink. Most men focus only on how much they drink, but timing and type of fluid can make a huge difference. During the day, your body needs water. You should not dehydrate yourself on purpose. That can lead to constipation, thick urine, and even infections. What helps is shifting your fluids. Drink most of your water earlier in the day. From morning until late afternoon, sip regularly. Then, after dinner, start to slow down. For many men, a simple rule works well. No large drinks in the last 3 hours before bed. That means no big glasses of water, no soups, and especially no late night tea, coffee, or alcohol. Why? Because caffeine and alcohol irritate the bladder. They act like a push on your kidneys, making more urine. This leads to more trips to the toilet, especially at night. So here's a simple daily plan. Morning to 4 p.m., drink steadily. After 4 to 5 p.m., slow down. 3 hours before bed, only small sips if needed. You're not punishing yourself. You're training your bladder and supporting your prostate. And one more tip, avoid chugging large amounts at once. Big drinks stretch the bladder quickly and trigger urgency. Small, steady sips are kinder to your system. Second habit, move your body and your bowels. This may surprise you. Your belly and your bowels have a lot to do with your prostate symptoms. When you carry extra weight around your waist, it puts pressure on your bladder. It also increases inflammation in the body. Both can worsen urinary symptoms. Regular movement helps in 3 big ways. It improves blood flow in the pelvis. It reduces inflammation. It keeps your bowels moving. Constipation is a quiet enemy here. When the rectum is full, it sits right behind the prostate. That extra pressure can make it harder to pass urine. Many men notice their urine flow improves when their bowels are regular. You do not need a gym membership. You don't have to run marathons. Start simple. Aim for 20 to 30 minutes of walking most days. Add gentle stretches or light strength work a few times a week. Avoid sitting in one position for long hours. Even standing up every hour, walking around the room, or doing a few ankle and leg movements helps. Now, about your bowels. Support them with more fiber, fruits, vegetables, whole grains, enough water earlier in the day, limiting processed foods and very salty snacks. If you're straining on the toilet often, talk to your doctor. You may need a safer plan for constipation. Never ignore ongoing bowel problems. Think of this habit as unloading pressure from your pelvis. Less pressure, less irritation, often calmer prostate symptoms. Third habit, train your pelvic floor and protect your bladder. Your pelvic floor muscles are like a small hammock under your bladder. When they are weak or uncoordinated, you may leak, dribble, or feel less control. When they are trained correctly, they can support your bladder and urethra. Pelvic floor exercises are often called Kegels. You might already have heard of them. The key is doing them right and regularly. Here is a simple way to find the right muscles. Next time you urinate, notice the muscles you use to stop the flow. Those are your pelvic floor muscles. Do this only once or twice to identify them. Don't make a habit of stopping midstream, as it can confuse the bladder. Once you know the muscles, you can train them anytime, anywhere. A basic routine looks like this. Gently tighten the pelvic muscles as if you are trying to stop urine or gas. Hold for 3 to 5 seconds. Relax for 5 to 10 seconds. Repeat 10 times. Do this 3 times a day. It should feel like a gentle squeeze. You should not hold your breath. You should not tighten your buttocks or your stomach strongly. If it feels confusing, ask a pelvic floor therapist or your doctor for guidance. Done correctly, these exercises can improve leakage, urgency, and control over time. Now, let's talk about bladder habits. Many men with prostate symptoms fall into a pattern of just-in-case peeing. They go to the bathroom very often, even with a small amount in the bladder. This trains the bladder to feel full at lower volumes. Instead, try bladder training. If you feel the urge, but you went recently, wait a few minutes. Do a few pelvic floor squeezes. Distract yourself. Then go when the urge builds properly. Over time, your bladder learns to hold a bit more. This may reduce urgency and frequency, especially during the day. One more important point. Certain over-the-counter medicines can worsen symptoms. Decongestants and some allergy tablets can tighten the muscles around the bladder neck. That means weaker flow and more difficulty starting urination. So, if your symptoms suddenly get worse after a new medication, talk to your doctor. Never stop prescription medicines on your own, but always mention your prostate and urine symptoms to your healthcare provider. Please remember something very important. None of these habits replace medical care. If you have burning, blood in the urine, pain, fever, or suddenly cannot pass urine, you must seek urgent help. But for many men with mild to moderate symptoms, these daily steps can make a real difference. They support your treatment. They give you back a sense of control. And that feeling of control, of being more at home in your own body, can restore not just your sleep, but your energy, your confidence, and even your desire to enjoy life again. Let's take a breath and pull everything together. If you are over 60 and dealing with prostate symptoms, you are not weak. You are not failing. You are simply living in a body that is changing with age. Frequent trips to the bathroom, slow flow, that frustrating feeling of never fully emptying broken sleep and daytime fatigue. These are not just little annoyances. They affect your confidence, your energy, and how you show up for the people you love. But today, you've learned that you are not powerless. We talked about 3 daily habits, simple, realistic, and designed to gently support your prostate and bladder. First, you learn to respect timing and type of fluids. Drink enough water, especially earlier in the day. Slow down in the evening. Avoid big drinks and bladder irritants like caffeine and alcohol close to bedtime. Second, you saw how movement and bowel health are connected to your prostate. Less sitting, more walking, a bit of stretching, and a diet that supports regular bowel movements with fiber and water. These things calm pressure in your pelvis. Less pressure often means calmer symptoms. Third, you discovered the power of your pelvic floor and bladder habits. Gentle pelvic floor exercises, done consistently, helping you regain control, reduce dribbling, and build confidence. And learning not to run to the toilet just in case, every time instead, slowly retraining your bladder to hold a little more. Are these magic tricks? No, they are not overnight fixes. They are quiet, steady habits. The kind that work slowly beneath the surface, supporting your prostate, your sleep, and your quality of life over weeks and months. And throughout all of this, one message stays the same. Always listen to your body. Never ignore new or worrying symptoms. Pain, burning, blood in urine, fever, or sudden inability to pass urine are red flags. Those need prompt medical attention. You deserve proper evaluation. You deserve a plan that is tailored to you. And you deserve to feel informed and involved in your health. Remember, you are not just an old man with a prostate problem. You are a whole person, with energy to protect, with relationships to enjoy, with life still to live. These small daily habits are a way of saying to yourself every day, my health matters, I matter. If this video spoke to you, I want you to take one simple step today. Choose one of the habits we discussed, just one. Maybe it's drinking smarter in the evening. Maybe it's a 20 to 30-minute walk after lunch. Maybe it's starting those gentle pelvic floor squeezes. Commit to that one change for the next week. Notice how your body responds. Notice how your nights, your energy, or even your mood begin to shift. And please remember, you do not have to figure this out alone. Your prostate health is not something to hide or be ashamed of. It's simply part of your overall health as a man. If you found this helpful, I invite you to subscribe to this channel. Here, you'll get calm, doctor-led explanations about men's health, aging, hormones, energy, and more. No scare tactics, just clear, practical guidance you can actually use. You can also share this video with a friend, brother, or partner who might be going through the same thing in silence. Sometimes one conversation can change a life. Thank you for spending this time with me. Take care of your health, and I'll see you in the next video.